I'm Dr. Heather Moore. Tonight we're going to talk about Little League elbow and how we can eliminate that with 3 exercises. I want to start off by talking a little bit about pitching in general, some of the things that I hear in here that are really red flags that as parents, you really want to pay attention to. I know I have 3 kids of my own. You don't know what to pay attention to sometimes because they complain about pain sometimes quite often, so you're like, is this actually for real? What's going on? But if your child gets off the mound, I don't care if it's baseball or softball or whatever, and they're complaining of elbow pain, telling them to throw some ice on it and get back out is not the thing you want to do, especially if they've complained of elbow pain more than once or a couple times in a row, or you remember the last time they complained of elbow pain. That's really a significant warning sign. Most kids won't come off the mound and just say, you know what, my elbow hurts. Maybe the first time you put some ice on it, but definitely the second and third time, it is not something to be ignored. And just because ice may help it and take the pain away, it is not something that you go, whew, as a parent. If they continuously come off the mound, or you've heard it more than once, and they're coming off and they're saying, my elbow hurts, you absolutely have to pay attention to that. That is not something that you can just ice or cross your finger and pray it goes away. That is something that, even though an ice bag might take the pain away, or maybe a little rest might take the pain away, it's not going to go away until you fix it. And you are really setting your child up for a much bigger problem. You're really setting your child up for failure in terms of pitching. And it will come to the point where they're not going to be able to pitch anymore. So, and it may take years, it may take months, it may take a long time, but that elbow pain, and it always starts as some low-grade elbow pain, and a lot of times I hear parents just say, I told him to ice it, he'll be fine. No, he won't be fine. Elbow pain is not something that you should ignore. Shoulder pain is you get a little bit more leniency with shoulder pain because after a while your shoulder can get sore. So maybe they ice that, but if you're noticing again that routinely they're coming off the mound and complaining of shoulder pain, this is one that you can ice it, and if it goes away, that's fine. But if you've got a week or two where they're pitching and they're complaining of shoulder pain, you want to take care of that. So that's just the red flag as a parent. It's stuff I hear all the time as a therapist, where I kind of want to cringe and go, nah, that's a parenting foul right there. So when you hear your kids complain of elbow pain, 100% get them off the mound, get the problem solved. So tonight we're going to talk about Little Leaguer's elbow. I have my trusty sidekick Dave here. So Little Leaguer's elbow is going to be pain on the inside of the elbow, all right? Generally comes after pitching or throwing. You're going to have sometimes some point tenderness. You might be able to point your finger right there, and they're going to go, that hurts. Could go all the way down the arm into that forearm area. Could go up the arm, all right? But either way, you're going to have some sort of pain in here. Now, why are you getting that pain? Because your shoulder is not strong enough to withstand, whether it's a curveball, a fastball, whatever you're throwing, your elbow is taking a lot of the force, which is why I say you've got to correct the problem. You can't just go inject it. You can't just ice it. It's not going to go away because every time they go on the mound, they're going to put the same amount of force through this elbow. So most parents, want to do what's right by their kids, so heads up, Little Leaguer elbow on the inside, they're going to come off the mound complaining of pain. So what can you do, and how do you take care of this? Well, because of this being a result of weakness in the shoulder, you really want to actually leave the elbow alone, and if you are icing the elbow, then continue to ice. It's not going to solve the problem, but it's going to take away a little bit of that pain and inflammation. So what you want to do is you want to do a lot of shoulder exercises. So tonight what I'm going to show you is we're going to do a lot of this external rotation movement. All right, so that's just moving away from the body. The important thing for this exercise is you're going to have your arm up against your side, okay, and you're just going to rotate out. Now this in and of itself is a very easy exercise, okay. You can have them hold a band in their hand and have the band coming out over here and then resist it this way. You can manually resist so they can push against you. Always let them win, so don't push so hard that they can't move, or don't push so hard that you push against their body. Always let them win, okay? but apply that resistance to their arm. You can also do this one by laying on your side, all right, with this shoulder up in the air and then doing this, okay? But that's the first position of external rotation that you want to do. You want to work your way up into adding some weight. You want to do about 3 sets of 15 because you're working on more of an endurance. You want this shoulder to be able to stabilize the entire game. You want to do a longer set, like a 3 set of 15. The next one you're going to do is the same external rotation, but you're going to bring your arm up to 90 degrees. Okay? So now you're going to rotate this way. All right? Again, you can have a band. They can pull. This one, you can put a soup can in their hand, and they can raise it up nice and easy. Now you want to watch that they're not elevating their shoulder. A lot of times as kids get tired, they're going to start to shrug their shoulder and then do it. Okay? You're not strengthening the correct muscles when that happens. So you want to really keep this arm at 90 degrees. So you really should have somebody watching them while they do this, or have them do it in front of the mirror, and then just rotate back. Again, this is a 3 set of 15, all right, because you're working on that endurance, not necessarily anything other than that. Again, you can manually resist them. You let them win, and then come back down, and then manually resist them, and then come back down. Okay? The final exercise that you can do is we're going to go back into this external rotation, okay? And what you're going to do is you're just going to hold it. You're going to meet their resistance, okay? So all you're going to do is put your arm against theirs and push and push and push and push, and then when you break them, the exercise is done, okay? So again, the elbow has to be next to the side, all right? Now they can do this up against a doorway if they want, but what we don't want to do is we don't want them doing this motion. So if they're going to do the doorway, if you don't want to resist them and you want them to resist a door or push into a door, that's fine, but you don't want them pushing out like this. That's a totally different exercise. Okay, so this, if you have a rolled up towel, you can put that right in there, so you're holding that. That's going to force you to keep that elbow there, and then all you're going to do is hold, hold, hold for a count of 5, and you want to do 30 of those. All right, as you get better at that one, you can really start to push a little bit more, but most little leaguers, most guys who are playing baseball in the minors or in the younger leagues are going to be able to be just resisted with hand resistance on that. Those are some really good rotator cuff exercises that you can start doing. There's several programs out there. I know a lot of baseball programs have them inherently. If your child is not doing them, they absolutely should be doing them. You cannot have a good baseball pitcher without doing some sort of shoulder rotator cuff strengthening exercises.